The World Health Organization defines maternal health as the health of women during pregnancy, childbirth, and the postpartum period. It encompasses the healthcare dimensions of family planning, preconception, prenatal, and postnatal care in order to ensure a positive and fulfilling experience in most cases and reduce maternal morbidity and mortality in other cases. The Sustainable Development Goal is set in order to improve maternal health, with the goal of reducing global mortality rate to less than 70 deaths per 100,000 live births.
As team members of Maternal Matters, our mission is to investigate maternal health disparities among different countries attributed to various factors and presenting solutions through multi-sector engagement and social innovation. We focused in on 5 diverse countries, 2 of which, Greece and Finland, have nationally funded health systems, which allows all of its citizens of different socioeconomic levels the rights and access to public health care. The United States maintains a mix of public and private health care that is not affordable nor accessible to all people of different socioeconomic levels. Central African Republic and Sierra Leone parallel each other in their limited public health care access and lack of professional medical personnel throughout the country.
According to the World Factbook, Greece and Finland have 2 of the lowest maternal mortality rates in the world, both averaging 3 deaths per 100,000 live births. The United States has a fairly low maternal mortality rate as well, at 14 deaths per 100,000 live births. But Central African Republic and Sierra Leone fare much worse, having the 2 highest maternal mortality rates at 890 and 1360 deaths per 100,000 live deaths respectively.
In order to reach the Sustainable Development Goal, there are a number of problems that need to be addressed. The lack of transportation and medical infrastructure greatly hindered those in Central African Republic and Sierra Leone, as many parts of the country are isolated from major cities where the limited medical infrastructure is available. Lack of women's rights in the United States, Central African Republic, and Sierra Leone keep mothers from getting the proper health care needed to support themselves and their children. Government structures play a large role in all 5 of the countries researched and are the key to success or failure of quality and accessible health care.
Improving the healthcare systems in these countries is unfortunately not as easy as taking what works in one country and trying to implement it into another. Though Finland and Greece have had great success with publicly funded national healthcare systems, trying to implement these systems into the United States, Central African Republic, and Sierra Leone would be no easy feat due to the current governmental structures set in place in each of these countries, nor is it guaranteed to succeed.
One possible solution is the implementation and development of social entrepreneurship. In this business model, people are trained to be healthcare workers, which in turn not only increases employment rate and education, but also allows greater availability for treatment of avoidable pregnancy complications.
Another solution involves the continued support and direction by large-scale organizations such as the World Health Organization, UN Women, Global Financing Facility, and International Rescue Committee. The involvement of these organizations requires government intervention and multi-sector engagement.
Although there are multiple yet challenging solutions that are specific to different countries, one common solution is to raise awareness of this issue, educate the public, and to never turn a blind eye. This awareness starts with you.